Good evening, everyone. Thank you so much for being here and for the privilege of your time. We don't do very many open mind programs in person anymore, so it's just so wonderful to see so many familiar faces and also so many new faces. So thank you so much for being here. For those of you who are here with us for the first time, this program is part of the Friends of the Semel Institute's Open Mind lecture and film series that brings together thought leaders at the intersection of science and culture for meaningful and relevant programs about mental health. And speaking of thought leaders, we are honored to have a nationally renowned thought leader with us this evening, the Honorable Patrick J. Kennedy, who's here to talk about his insightful and compelling new book, Profiles in Mental Health Courage, that he co-wrote with award-winning science journalist Stephen Fried. Nearly 7 decades ago, Patrick's uncle, President John F. Kennedy, wrote the Pulitzer Prize-winning classic Profiles in Courage that portrayed American patriots who at crucial moments in our nation's history showed great courage that moved our democracy forward. Patrick Kennedy's new book, Profiles in Mental Health Courage, which we also hope will win a Pulitzer Prize, captures the essence of mental health courage through 12 poignant and revealing narratives of individuals from different backgrounds, all ages, who have mental health and addiction challenges, who are meeting them with courage, fortitude, and resilience. We owe a tremendous debt of gratitude to Patrick Kennedy for the gift of this book and for his unwavering courage and commitment to shedding light on mental health issues and advocating for positive change to our mental health care system, which certainly needs some change. So a brief glimpse into Patrick Kennedy's impressive background reveals his instrumental role during his tenure in Congress as the primary author of the groundbreaking Mental Health Parity and Addiction Equity Act, which requires insurers to cover treatment for mental health just as they do for physical health. As founder of the Kennedy Forum, he now unites advocates, policymakers, and business leaders to advance evidence-based practices and policies in mental health and addiction. In 2023, the Kennedy Forum launched the Alignment for Progress, a movement to align leaders from across industry and across the aisle to transform our mental health and addiction systems. He currently serves as co-chair of the National Action Alliance for Mental Health and Suicide Prevention's National Response to COVID-19 and is the co-chair of the Bipartisan Policy Center's Behavioral Health Integration Task Force. That is a mouthful. We are also honored to welcome back to the Open Mind Dr. Jonathan Sherin, who will join Patrick in discussion in just a moment. Dr. Sherin is the principal and CEO of the Eudaimonia Group. He's a psychiatrist and a neurobiologist by trade and serves on multiple private and public boards to advance the health, well-being, and connectedness of disenfranchised populations. And until his recent retirement after decades of public service, he directed the Los Angeles County Department of Mental Health and the mental health departments for the Veterans Health Administration. Throughout his career, he has driven wholesale systems transformation and policy reform with a heart-forward and speak truth to power approach based on his conviction that the grassroots must inform and drive the grass tops. I love that. His accomplishments range from developing holistic community-based care settings to showcase the importance of lived experience to reimagining government funding, which he finds to be simply backwards. In addition to his work in health and human services, Dr. Sherin is an accomplished scientist who has published in neurobiology and psychiatry. He's received national acclaim for his research identifying a core sleep circuit in mammals, the sleep switch, featured in Science magazine, and received a prestigious Kemp Award from the APA for his conceptual model of the psychotic process. We are also very proud to say that Dr. Sherin serves on the Faculty Advisory Board of the Friends of the Semel Institute. And in that capacity, he reached out to his friend Patrick Kennedy to invite him to join us this evening. So thank you, Dr. Sherin. Also with us this evening is Mike McMurray, a private equity investor in several businesses, including healthcare data analytics and mental health care services. And his son, Harry's story, is featured in Profiles in Mental Health Courage. A few housekeeping notes before we begin. Following the presentation, we will have a dessert reception, which you are all invited to. And Patrick will also be out in the foyer signing copies of his books, which you can purchase right outside there. The UCLA bookstore is selling them. We don't make any profits, I promise you. If you want to ask a question of either of our speakers, we ask that you please write it on the index card that you received on your way in this evening. And if you didn't get one, don't worry, we'll bring out around some more cards. And tonight's program is also being recorded. So if you want to listen to it again, or you have friends, family, or coworkers that would like to watch it, it will be on the Friends of Semel YouTube channel, which you can find on our website, friendsofthesemelinstitute.org. There you'll find information about our more open mind programs, most of which are virtual, so very easy to tune in, and about our scholar program, about our Teen Advisory Council, which we just started, and our Open Mind Film Festival for high school students. So without further ado, it is my honor, and please join me in giving a warm welcome, and I don't have to say a warm Zoom welcome like I usually say when we're online, give a warm welcome to Patrick Kennedy and Jonathan Sherin. Thank you so much.
Thank you so much, Vicki. And thanks for all you did to pull all of this together, and for everyone else who was helpful in making this happen. Appreciate all the good work Semel does and bringing the best science to the fore, and also really engaging everybody in conversations that are too often not had. So thank you all for being part of that. John's my hero. I'll turn it over to you since you're the one who's supposed to be saying all this.
Thanks a lot, Patrick. And thanks to Semel. Thank you, Vicki. I love this place. I still am a professor here, although I don't work quite as much as I used to on this campus. And I literally just got here from Baja. I just flew back from Baja, where I've been spending a lot of time. And someone said, "Oh, you're Baja fresh." So I'm feeling that way, and it's really quite lovely. But I mean, you know, Patrick, coming here to do this with you and getting to hang out with you is a testament to kind of how I feel about you as a friend and colleague and hero. And, you know, courage is kind of the term, you know, it's in your book, it's in your uncle's book, and it defines the core quality and value and sensibility that you shined on me. And it's rare. It's really, really rare. And it's something that has to kind of be embraced in a way that I don't think is done in the mental health field, or frankly, across the board in our political circles. I also just want to reflect really quickly upon the first time I met you. I met you along with your cousin, Bobby Shriver, who just showed up with a helmet on. And Bobby and I worked for a long time on veteran homelessness and the reinvigoration, the rebuilding of the VA campus, which many of us know is across the 405 over there and really continues to languish in ways that are totally unacceptable. And I got to drive you around in my truck, which I left in Baja. And you listened and you looked with a curiosity that is unusual. And I'm just talking about these principles because these are the things that are in my heart when I think about you as a colleague. And they're the highest order qualities, in my opinion. So I thank you for that. The other thing is you're a total animal. You've been doing this book tour is like outrageous. I saw, I've been getting these emails, and I'm like, you got to be kidding me. So your energy is really impressive, and maybe I'll write a book because it looks like a lot of fun.
I'm gonna need to know more about that sleep research that you were so
Yes.
instrumental in.
Well,
Discovering.
I can send you the paper from '96. It'll actually help you sleep, although it was a very important one. So the first thing I would say to you is that, we all have an opportunity to step up. We all have an opportunity to have courage and to be heart forward, which is what I like to talk about in all of my work, whether it's taking care of homeless on the street or trying to re-steer a massive organization that's deeply, deeply dysfunctional. But I want to hear about your personal story, because your personal story is what led to your first book. It's what inspired people in the second book. And it's the core of the campaign that I believe you're forming.
Thank you. Well, I wish that I could have been a profile in the kind of way that my cousin Mark was a profile in this book, because he had the courage to come out and voluntarily tell a story. I was not voluntarily choosing to come out. I was, being a mental health advocate was the furthest thing from my mind. And what happened was, in my first term as a state representative, I got a call from my chief of staff who said, Patrick, you're not going to like this. And I, said, well, what's that? You're on the cover of the National Enquirer. So the guy that I had been in drug rehab with had sold his story of being in drug rehab with me to the National Enquirer, and there was a big picture of him next to me. The headline with me is Patrick Kennedy, drug addict, and then his roommate from Spofford Hall, which is where I went to treatment in New Hampshire, Rob Remy was the guy's name, and he lived in Massachusetts, and I'll get to that in a second. So I thought my short-lived political career was over, because this was back in '91. I mean, how could you not think it was going to be over? Because back then, this was definitely a career killer if you were in politics. But I went over to my neighbor's house, Frank DiPaolo, and Frank was not only just my neighbor, he was my campaign treasurer. And I remember why I asked him to be my campaign treasurer, and it's because it was a very Italo-American neighborhood that I was running in. And the guy that I was running against was named Skeffington. And Skeffington of Irish, Kennedy Irish, we split the Irish vote, but I needed to win the Italo-American vote. So I went to this guy who owned the biggest restaurant in my neighborhood, who was Frank DiPaolo. And I said to him, would you be my treasurer? And he said, well, I don't know anything about numbers and accounting. He said, I didn't even graduate from high school. But whatever you want. I said, it doesn't matter. I just need your name, because under law, your treasurer's name has to go on all of your literature, your lawn signs, your campaign brochures. And I wanted everyone who got my literature to know that Frank DiPaolo was my guy, because they all loved Frank. So anyway, you can imagine how full of shame I felt, because of course I had never told Frank that, I was recently in drug rehab. I was trying to put that in my rearview mirror as quickly as I could. And so I went over to his house, and he was literally at the stove stirring his pasta fagioli. You can't make this stuff up. And I said, Frank, I knew everybody had seen this. It's on every checkout counter in my neighborhood. And he just shook his head. And I'm like, oh, God. He's just so upset with me. And then he murmured, that rat. That rat bastard. And he turned around, his fist in his head. And then he paused and he said, buddy, you want me to do something about this? I mean, this is all legit. I'm telling you the God's honest truth. This is how it went down. And I grew up in McLean, Virginia, so I was not like really well versed in this colloquial rat, what that meant and everything else. But I kind of determined that when he said, I'll can I do something about this? That was not a good thing to say yes to. So, needless to say, I knew I was going to survive my political campaign because Frank decided to go all around the neighborhood and go, that rat, we're going to stick with Pat, not the rat. And so I ended up winning that next election overwhelmingly. But long story short is, so I never volunteered to say any of this stuff. But when I did my story, I was able to use it to show others that this is kind of what I was working on, because I had already told my story in a common struggle. And so, you know, the people who I've asked to be part of this were able to see the kind of writing. And I have to give great credit to my co-writer, Stephen Freed, who I had met years earlier, done a magazine profile on me at Philadelphia Magazine. And I just knew this guy knew how to write, especially on this subject. He'd done a lot of writing about mental health. And this is such a difficult subject to capture with dignity and with accuracy. And when I had gone through it with Stephen, he got my psychiatry notes, my whole medical records. He, you know, we got all my old notes from my psychiatrist. We went around, you know, interviewed them. We interviewed everybody that had been in my life. Like he really, I knew he was about getting the full 360. And what we don't get much of these days is that 360 kind of perspective on these issues. You often hear people who tell their story as if it's separate from their mother, their father, their sister or brother's story, because we're all in it together. And if you're in a family, when someone has the illness, everybody suffers. And they're not often included in the narrative. And so, you know, we decided to do this, you know, extension of what we had started with the common struggle and do 12 people, you know, as Vicki mentioned, much modeled after my uncle's book Profiles in Courage, where he did 8 senators. And in the course of that, 4 of those 8 that we know of, it could be 8 out of those 8, but 4 out of the 8 senators that John F. Kennedy profiled all had mental illness in their immediate family. So John Quincy Adams lost 2 of his brothers to alcoholism in their 30s. He lost his oldest son, George Washington Adams, to suicide at 28. Sam Houston, Marx from Texas, the first president of Texas, later to become a U.S. senator, was known as the big drunk. He was already an example of a politician being shamed for his illness. Daniel Webster, who was the great abolitionist from Massachusetts, who was my late father's hero in the Senate, died of cirrhosis of the liver. Lucius Lamar, who was one of the senators featured in John F. Kennedy's book, was 8 years old when his father went out into their front yard and took his life. And you just know that's 4 out of the 8 that we know of. And that's not easy to document something that long ago. So the point of that was to first say, this has been going on forever. This is not a new issue like we often write about because of COVID and somehow coming out of the closet finally. These are new issues. These have been around forever. But the other point was that it was never talked about. And part of this whole process was to get a focus on real courage to tell the full story. Because we all tell something, but we don't tell it all. And that's the big difference. People today will say, oh, I have a diagnosis, but they don't say much more than that. You get lots of celebrities are now saying that they have diagnoses, but we don't really know, what does that mean? How do you live with that diagnosis? You know, what is it? How does that work out in your life with your spouse, with your child, at work? How do you negotiate relationships in your life? These are the things real Americans and everybody needs to know about so that it's more transparent that these illnesses are complicated. and they're messy, but that's okay because that's just the way it is for everybody. And since so many people feel isolated because they think everyone else is doing better than them, they're more feeling alone because they're not reading about what they're going through in these other stories. And I've been fortunate to be in recovery. I have a book in my 12-step program where I get to read about other people with the disease of alcoholism and addiction. And it's so sustaining to me to know that no matter what walk of life they come from, we all identify with each other and our experiences. Most Americans who aren't in recovery either don't have that access, or if they have a mental illness, there isn't something comparable in the mental health world where people can learn about what it's like to live with bipolar or schizoaffective disorder, with eating disorder, with all of these other illnesses. And so that's the purpose of the book. And when you read about Harry, Mark's son, you read about Harry, but you read about Mark, you read about Harry's brother, you read about Harry's roommate, and you have a much better idea of what Harry was going through because you heard it from multiple different perspectives, which in this world of mental health, we don't often have. We just have a singular perspective, but not the full perspective. So, and that's because we don't talk about these issues. And we all keep it, oh, I don't want to violate their personal space, or I don't feel like I can intrude, or well, that's their business. You've all heard those expressions. That's why we don't share, because we just are too apprehensive. And that's a hangover of the shame and stigma that's long pervaded this whole illness. So
If I could just
Mark
add,
is Mark's the one we need to hear from.
no, you're doing great. I'd just like to say that the process that we went through was so interesting because obviously as cousins, we trust each other. And the first thing that I thought of was I didn't know where this book was going, but I knew that there was going to be some public good involved with this because of everything that Patrick does and our family collectively. There's a lot of public good involved there. But the safety in the way it started was that you could tell your whole story, but you could opt out at the end before it was published. You could just say, I don't want everybody to know my story. And so if you haven't read the book yet, there's a couple of people in the book that you would know, and then apparently, and everybody uses their real name. And so it frees you just to tell your story. And, sometimes it was difficult to get there because there's some certain things, even with that freedom, there's certain things you may not want to say because for example, Harry's mom didn't want to participate for her own reasons. And it's like I was trying to protect her from some of the things that may have happened. And then my daughter Stella was interviewed, and then she ultimately decided not to be quoted, but she did go through the whole process. And first of all, going through the process was great for all of us, just to unload some of the things. Obviously learned some things from my son and from Harry's roommate, because towards the end of Harry's life, he was away at school. So a lot of his personality changes I didn't actually see because he was away at school. And he didn't have what you would call a traditional depression. It was caused by a brain injury. So we weren't really fighting, a longstanding depression over the course of years, which is more common. But to have that safety of being able to opt out, I think you end up with a much better story. And then Stephen, the writer, would actually push us some just to say, he would ask us about a certain thing. And then I would say, well, I've said what I want to say about that. And he would be like, yeah, I know, but there's more there. And then, and he would get it. And it turns out that, it's important. And there's a couple of situations. I don't know if I can tell the story about that. Okay. So one of the subjects, I think they're from Los Angeles, but the grandson had been to multiple rehabs, every kind of rehab you can think of. He was doing a lot of drugs, selling a lot of drugs. Just the whole family was, it was on fire because of this one kid was just, really having a hard time. And his grandfather turns out to be a very prominent psychiatrist, and he was interviewed for the mother was interviewed, siblings, the grandfather, and he had said that towards the end of this whole experience with his grandson, he had it with this kid. He was like, I've done everything I can do. I know all the tricks, and this whole family is fed up with this kid, and we just are about ready to give up on him. So that was part of his story. And then right before publication, he went to you guys and said, I just want to take that out because that's just not right for me to be in my position to withdraw my story. And you and Stephen were like, if you don't say anything else, this is the one thing that needs to stay in this book. Because if this guy can get to the end of this thing and not want to continue, that's exactly the way most people feel, if it goes to those great lengths, right? So that's what you're going to get in this book. And I think it's so valuable. And in our case, I told Patrick at the very beginning, I don't know how many chapters you're going to have or whatever, but if you need to cut it, you can cut us because we got so much out of it that I'm happy just to be on the cutting room floor, as my friend Paul would say. But it's by the way, Harry's godfather is sitting right here, Paul Gurian, and my former next door neighbor, and just love his experience. He's got a wealth of knowledge around mental health issues, and I'm just so happy that you're here tonight. And my partner Liz, we're in business together in the mental health space, and frankly, we're all in this thing together. I would much rather let everybody else sort out their mental health issues and have my son back, but that's not the way it works. So we're doing the best we can with what we have, right? And tribute to Patrick. I mean, he's been on the front lines of this for a long time. So thank you.
Well, when I went to Harry's funeral, I remember Mark said to me, Patrick, I know you're the big mental health guy in our family, but I didn't think it had gotten that bad. And he just lost Harry to suicide. And isn't that the story? We all say any of these big tragedies you read about and you hear about, everyone's always saying, I didn't think it was that bad. And that's part of the problem with these illnesses is we have this idea in our minds that it's supposed to get really bad before we can ever get help. Like we do not have the idea that we have in cancer, which is we screen these things stage 1 as opposed to treat them after stage 4. And until we change that, we're going to still continue to see the tragedies of the numbers and suicide and overdose continue to escalate because we haven't done the most fundamental thing. And that is, as you've always advocated for, John, have a public health system which really identifies people who are high risk and get them before they even are, get down on a road where they're clearly needing intervention. So you don't have to wait until it's too late. And
Yeah. I was going to ask you to talk a little bit about the what it took for you to write your first book, because I as someone on the sidelines, I know that wasn't well received by certain folks, particularly even in your family. And that's the kind of thing that people face and struggle with that prevents, us moving in a direction of more transparency. But I'm not going to go there.
No. So this is really instructive. So people say to me, well, what's so common? You're a Kennedy. How could what you've been through be common at all? And I say, well, I wasn't supposed to talk about this. And, my family, you say a word about this and you're betraying the family, and when my book came out, my brother Ted called me and he said, Patrick, this is going to permanently change our relationship. And it did. I talk to my brother frequently and we get along fine, but it basically fundamentally changed. And the reason I mentioned that is because he felt he was defending my father's, name, because I had the audacity of saying my father suffered from alcoholism, as if that's a big surprise. You know, like you could literally go into any bookstore in America and find legions of books, you know, all in the scandal section about my father's drinking. My mother was well known in her alcoholism, and that was all scandalized. But my point is, there was no secret there. And nothing that I said in the book was like opened anything up, didn't say anything. And yet that was strong enough to just have that visceral response. And I think that it's the case for most people. You wouldn't want to say this. And so that's the common, when I say a common struggle, it's really the common is none of us want to talk about because we feel so ashamed. But, you know, my dad went through, you know, a lot. If you wanted to look up post-traumatic stress, and before we even knew what that meant, you know, it'd probably be a picture of him in terms of all the stress and trauma he had undergone. But he wouldn't or couldn't get help because to do that would have looked like he was weak-willed or didn't have, and he was already like operating well beyond what normal humans could ever operate in terms of success and, you know, ability to get things done. But I can only imagine if he had ever been able to get free of that 800-pound gorilla on his back, because he could have gotten help and no one would have questioned it. Maybe back then they would have. Today they would have been like, oh, of course, you got to go get them. You know, he could have been whatever he wanted in life. And it was, you know, so these things, secrecy is like we say in recovery, we're only as sick as our secrets. The more we hold this stuff inside, the worse we're going to be as a nation.
Yeah, and I think it's really relevant, the thread about screening. I mean, certainly in the Department of Mental Health here, there were major efforts to look at mental fitness the same way we look at physical fitness. You know, so I used to spend so much time at the state begging the Department of Education to make it a part of the curriculum, to pull out some stuff and to put in screening and opportunities for kids to process what they were going through. You can't learn, you can't teach if you're under duress. And I think that is a manifestation of stigma. And those kinds of things, if we can switch them where people are talking about it, they're talking about it with their family, they're talking about it with their brothers and sisters, their friends, their teachers, then we get into a whole new realm, just like we do when we identify physical health challenges early and people get right in front of them. So with that in mind, you know, I've seen you talk about a number of things, and one of them, which is something that I can't entirely wrap my head around, is the whole confluence of factors. You know, right now, the tidal wave of mental health, right? You got COVID, you got social unrest, you got structural racism, you got climate change, you got war, you've got issues with economies. I mean, these aren't necessarily new things, but they're seriously being showcased along, you know, and under the COVID umbrella, which to me is in many ways a silver lining, because it's bringing more visibility. And if we don't get that memo now, I don't know when we ever will. But my question to you is it simply that there's more awareness? Is it simply that there are more stressors globally on society? Is it a combination? How do you see it?
Yeah, it's definitely a combination. I think we have unearthed something that was already there, but certainly all that you mentioned in terms of the societal stressors and traumas, the toxic environment, that's no doubt making it really, really hard. And of course, we all talked about social media and how our kids are less resilient because they're so locked into these technologies that really have made it more difficult for them to live a life where they learn failure and they learn patience, they learn all those difficult things, because this is a drug, the phone's a drug. And so that really distorts perceptions. It distorts their ability to self-modulate. I mean, we all know technology has been a major factor, and among other things, in the confluence of things that are leading to our kids suffering so much.
No, yeah, I would completely agree. And I'm down, I used to have 3 phones. I'm down to 1. And I do think about tossing it in the Pacific from time to time, and someday will. But I guess the thing that I believe is most important to you, and frankly, your cousin, Bobby, who I hope is still here, really taught me, there he is, hello, sir, is the importance of advocacy. And you've talked about it. Where's the AFL-CIO in the mental health space? Why are not all of the committees considering in Congress mental health implications of what's going down? We're all so obsessed with wellness, well-being, mental health, but we don't have the kind of alignment we have around cancer, around AIDS, around these massive issues. What are your thoughts? What are we missing? How is this not happening right now?
Well, I call our movement the Alignment for Progress. My uncle had the Alianza de Progreso, which was about all the countries of the Americas being partners. But I thought alignment is what we need in mental health and addiction. We need to align all of the different facets of the biopsychosocial needs that someone has to better make sure that they're working together. So what we have are really good talk therapies, but they don't include supportive housing. We have really good medication management, but it's paired with bad talk therapy and no social supports. In other words, we've got good evidence-based kind of therapies and systems, but they're not integrated. And so it's the 3-legged stool. Stool's going to keep falling over. We're not going to get people better until we acknowledge that these are a 3-fold illness, and you have to deal with them in that way. Some people need more of one thing than the other, but the bottom line is this has got to be a comprehensive approach. So that seems, it's too complex. Housing only has the housing budget. How are you going to know how much money to put in there? And the labor department's got so much job training and supportive employment. And how are you going to coordinate that? And CMS doesn't have this, and how do you do health? And what about the human services people are going to need to live in the housing, get supported in human services? And what about the social services? How are you going to coordinate all this? So I think what we need is a strategy, and then we need to have the power to enforce all of the various agencies and departments of government to implement that strategy, because none of the individual bureaucracies of budgets are going to work with each other unless they're made to work with each other. And that requires special authority in the Office of Management and Budget that would allow us to literally zero out any area in any budget that doesn't conform to the national strategy. Because then you're never going to get this right unless we have the full support of every aspect of us addressing this. So I think it's eminently doable. We just I think you have to have something in the executive office of the White House. I think all presidents from here on out are going to want to show whether they're making progress on this national, public health challenge and tragedy or not. And it'd be a great way for them to articulate a strategy and have the whole of government conform to that strategy. Because then you can't really expect to have the braided funding. I love braided funding and I love value-based contracts. And you kind of need to direct this until we can get to a day when the state's putting up money to prevent the criminal justice spend, the city's putting up money, the feds are putting up money, and the insurance companies are putting up money, so that you get the cumulative impact of all of that investment to reduce the cumulative impact of the cost of not dealing with this, which unfortunately is spread across so many systems that it's impossible for the political urgency to capture this in a simplistic way, because we're all paying for it in a lot of little ways that are very distinct in different people's budget who never see how they're going to solve it themselves.
Yeah, I think you're right. I mean, the understanding mental health is such a massive challenge. It's so many different things. And I would agree with you that we don't have integrated payment systems. And as Vicky was kind enough to say, and I wrote earlier today when I was cutting down my bio, and I didn't really know how else to describe it. The way that things are funded is backwards. And it's backwards because it's top down. And these are well-intentioned ways to get money out into the trenches, but they're crippling in the trenches. And the only way, I believe, and that I've argued for as the fundamental theme of payment reform, and I'd like your thoughts on this, is paying for outcomes. If you are telling the housing providers, if you're telling the people that are doing supported employment, if you're paying the people who are doing the human support, the different types of treatment for outcomes for individual human beings, they have no choice but to work together. And then to advocate up the chain, I ran the Department of Mental Health. All the addictions money went to a different department. And even if they were in the same department, they couldn't be integrated. You can't have someone going to get mental health treatment and addictions treatment at the same time. That's the federal government. So that is really fundamental. And I mean, I like to talk about people, place, and purpose as what defines community and what people need. And I would wonder your thoughts, given all of your experience in DC, what we can do to get CMS to stop paying for services on a fee-for-service basis, which is generating sausage that nobody really wants to eat and that's not even very healthy, as opposed to paying for outcomes at the trench.
Well, first, I had the honor of being the sponsor of the Mental Health Parity and Addiction Equity Act when I was the youngest member of Congress from the smallest state in the country and in the minority party. So I was the lowest guy on the totem pole. And that tells you where stigma was. That no member of Congress wanted to put their name on a bill that had both the words mental and addiction in the title of it. I don't know why. They, I guess, may have been worried the press was going to ask some follow-on questions. Like, do you have this in your family, in your life? And no politician wants to go down, nor anybody wants to go down that rabbit hole of having to answer all those questions. So when I look back in my life, I thank God for Rob Remy, the guy that ratted on me. Because if he hadn't ratted on me, I would have gone through my time in Congress constantly trying to hold it all in and keep it a secret. Obviously never successfully. And I would have missed the greatest opportunity in my life, which was to connect to an issue that was so fundamentally personal to my family. The dismissiveness that we all treated my mother with because of her alcoholism. You know, both Mark and I, you know, we have similar experiences. Both of our mothers are sisters, and then our grandmother died at 61 and wasn't found for a week because she had isolated herself because of her alcoholism. And so these things are, you know, I never would have been connected to all this if it hadn't been for that rat bastard. And so that's not answering your question, whatever, John. But I will say we definitely, if the money is in, you know, avoiding the cost, like you have someone who's a chronic, you know, ER, you know, they say if you're not going to get them, well, you're going to eat the cost. And guess what? They have an incentive to make sure you don't come back to the ER. If only we had that in our criminal justice system, where we have 75% recidivism, 5 years, 50% recidivism in 2.5 years. Like, instead of paying for more heads in beds, which is what our current criminal justice system does, if we said, here is money, private sector, when they come out of prison, you keep them out and you got to keep and pocket a portion of those dollars. And you bet someone who's financially motivated like that is going to take care of their housing, their supportive living, help them get the job and vocational training, and whatever it's going to take to get the med management, to keep that person from ending back in jail. That's going to happen because they're going to be able to make money off of it. And right now, the system, you make money off the sick care, not the health care. So that's the big conundrum.
Yeah. No, I mean, I would agree when, back in the Department of Mental Health, and if there's anyone here that works in the Department of Health, the mental health, God bless you, and it's nice to see you. But I was called a lot by the emergency department. And they're like, oh, we're so glad there's a new director. We have a client here who has an intensive team that's supposed to be following them. And we're calling and they're saying, oh, that person, this client must be really sick. Put him in the hospital, get him better, and then we'll come get him. I didn't understand that, but it's because they wouldn't get reimbursed for going into the hospital to go and take care of someone that they had a relationship with. Talk to the treatment team. Those are the things that matter. Those are the things that would achieve outcomes that had to be paid for. So I think your legislation around the Parity Act is the most important mental health legislation that exists. And unfortunately, and you and I've talked about this for a long time, and we both have barked up many, many trees, it's not being implemented at all, really. I mean, people talk about it. Even our governor has pushed. We've got bills that you and I helped get through. I don't remember what SB it was. It was one of them. But it didn't really matter. So when we connect parity with outcomes, the systems will transform from the bottom up. And that's my feeling about it. And I guess what I would say to you is, how do we get the campaign? How do we do the advocacy work to make it happen like we have for other massive disease issues, like with AIDS and cancer, et cetera?
Well, we just take a page from these other movements. So we decided to have a national goal, 90-90-90 by 2033. 90% of Americans screened, 90% given evidence-based therapies, and 90% it's supported in recovery, which is treating it as a chronic illness and doing the social supports, social drivers of health and so forth, that are left out of the picture. So 90-90-90 by 2033. Now, if you expected anything less from diabetes or cancer or anything, you'd just be like, no, 90, but at least 90%. We're maybe at 10%. And if you ask most mental health people, they'd be like, oh God, if we can get to 40%, oh my God, that's way too big. You're thinking too big. And that's literally, we are our own worst enemy in the mental health world. We do not think big. And part of the reason we don't think big is we don't see big. Like, big is the numbers in every state rep and congressional district that care about this. But because of stigma, we're all anonymous if you're in recovery from addiction. And most of my fellows in recovery do not know that they can say they're a person in long-term recovery and in a 12-step program and not be violating the 11th tradition of our 12-step program, because I'm not saying which program I'm in. And that all is kosher. But I care about this issue, which means that I'm going to vote on this issue, which if politicians knew there were 30 million people in long-term recovery, years and years of sobriety under their belt, were out there voting on this issue, this thing would change overnight. If you added to those people all the families, the families of all the 110,000 people who overdosed last year, if you added to that the 55,000 families of the 55,000 who took their lives last year, if you added to that the 350,000 who died of alcoholism, if you added to that all the people who are family members of people with schizophrenia and bipolar disorder, if you added to that, I'm telling you, we are the biggest, most powerful special interest group in this country that has no power, has zero power. So, when I was in Washington, cancer would say, oh, we need another $500 billion. Okay, is that okay? I gotta sign a check. And HIV, we got to do this. Yeah, okay. But mental health, we're like going through, are you sure you need this? And you're going to check this. Like, there is just, we give carte blanche to because, the advocacy is so strong. God bless the American Cancer Society. You're going to get a new cancer drug out there. Florida doesn't have to worry about whether it's going to get reimbursed. it's reimbursed because no insurance company would dream. I don't care if the margin of benefit for that new expensive drug for cancer therapy, only increases life expectancy by 2% and costs a gajillion dollars. Doesn't matter. We're covering it because no one would think of not covering anything that remotely improves cancer. But mental health medication, try a non-addictive analgesic. We have pain is rampant. Number of people who die of opioid overdose who get started on opioids. You could do so much. We had warp speed for a COVID vaccination. What about warp speed for a non-addictive analgesic? It can absolutely happen. I've talked to all the neuroscientists. It can be done, but we don't have it as a priority. We don't have people knocking down the walls at FDA like the ACT UP groups did during the height of the AIDS epidemic. The AIDS consumer said, screw this. We need therapies now. They called up their members of Congress. There wasn't a community meeting any politician went to in this country where it wasn't disrupted by AIDS advocates. And guess what? They got the therapy. It short-circuited the whole FDA process, just like we did with COVID. Lives started getting saved. I mean, that's what we're missing in this movement. We had United Healthcare was found dead to rights for violating every standard of medicine you could imagine because they were making up their own medical management criteria and determining here in California who got what and for how long and what level of therapy. All of the criteria on all of that was being cooked up in their back room and had no correlation to generally accepted standards of care, like you would assume would be the case in any area of medicine where an insurance company is making the decision on what kind of treatment you get and how long that treatment should be. I couldn't get 10 people at the courthouse to protest that. I got all my friends, the NAMI and MHA and the psychiatrists and the psychologists. A psychiatrist, your crowd was just in New York City a week ago. Meanwhile, that parity, we had the opportunity of a lifetime to implement that. And guess what is happening while they're all talking about how they're going to save the world? American health insurance plans are giving us the ship right now, this parity, because they are flooding the Biden administration with, we can't do this. We're going to litigate if you push this thing through. You don't have this thing clarified enough, blah, blah, blah. And meanwhile, you have 35,000 psychiatrists all hearing themselves talk 100 miles away that if they were in Washington, D.C., instead of going to the Javits Center, they would do more good for mental health in this country than all the great science. Not to take away anything that they're doing. It's great. But my point is there's no urgency. And we see all these kids protesting around. If they if they were spending a fraction of energy that they are spending on what they're doing now on this issue, change that overnight, we'd have change. So it's all about the politics. And I've tried to get somebody with enough money to say, let's buy up all the lists. Let's buy all the bipolar lists, the schizophrenia lists, the addiction list, the opioid list, the alcohol list. Let's buy up all the trade groups, psychiatrists, psychologists, social workers, clinical family medicine. You buy all those lists up, put it in one listserv, and be able to hand it to anyone running for office and say, this is how many people we can identify now. And we're only scratching the surface. That even with the most conservative aspects of this, we would have a bigger list than any other single interest group. And I, for the life of one, I'm going to do a book party in Nantucket this summer. They have 78 billionaires live in Nantucket in the summertime. One of those people could dramatically change this whole system. And I've had the honor of talking to Warren Buffett and Bill Gates and all of them about it. oh, that's great, actually, because of course I'm like, I have come up to them with all my wide-eyed idea, and they're like, no, I don't want to hear from you. This doesn't seem right, But can someone else go and talk to them that can be more convincing than me? Because it's really unbelievable in this day and age that there's zero philanthropy. I mean, you all raise a lot of money, and I love Semel, and I love what you guys are, but let me just tell you, in the bigger picture of things, there is zero philanthropy in this space. It's just so against the need, obviously. So yes, we're making progress, but we're missing the forest from the trees. This is going to demand a kind of strategy and energy that we can't even conceive of, because and until we get it, we're just going to be around the margins and still seeing the tragedies that we see every day unfold.
Yeah, Mark, I'm wondering if you have any, from your perspective, given the things in your life, and you're hearing this dialogue about the broken systems and the ridiculous funding streams and the lack of focused, strategic advocacy. What are you thinking? What do you think about that?
Well, I think that it's just like anything else. If you could get ahead of if you turn the spigot off, right? So if somehow you could get some predictive analysis around mental health issues, and the data's out there, it's just that how can we get at it? So there's some privacy issues that are involved, but just think about the way the kids communicate with each other, or the way people, it'd be so easy just to get in front of bullying, for example, where if somehow you could just read the incoming text for kids. Obviously you got to get permission to read that sort of stuff, but somebody that was already in recovery, if the parents would say, yeah, we'd love to be able to read the incoming text and parse the language and say, okay, there could be a mental health crisis ensuing. That technology is out there. I mean, excuse me? And so to me, that would be a great place to put money. We were talking about this the other day. I'm from Houston, and there's a wonderful recovery center called the Menninger's Clinic. And if you walk in there, and there's a wall of all the donors, and if you compare the names on that wall to the Forbes family members, there's probably at least $100 billion in wealth just on that wall in Houston. And obviously everybody that's name is on that wall, they've had one of their family members in that facility. And it would take a small percentage of the wealth of just that group. And there's a wall down the street from here somewhere, or several walls down the street from here. And it's frustrating because, like you said, I mean, from a public policy standpoint, you obviously know what you're doing, but from the private side, just the amount of pain that so many people are going through in this country, and it's not tied together. It's not just one illness. The comorbidity is so high, and it's just fascinating to me that you can't get a pledge like Warren Buffett has this wonderful pledge that he does for people, and they certainly spend their money on interesting things. But how about a big percentage of that just to mental health, and let somebody that knows what they're doing figure it out, because it's just lacking in funding and focus, and it's certainly well deserved to have it happen.
Yeah, I mean, I think obviously there's not enough funding. There's no question about that. The way that the funding is spent is absurd. But what I think, Patrick, what you really represent to me, you are the center of gravity in the advocacy space that is not getting where it needs to go. So whether it's warp speed on homelessness, or warp speed on a new treatment for psychotic disorders, whether it's insisting on parity, demanding parity, and telling the insurance companies that they're going bankrupt if they don't deal with it, that's the most powerful thing that needs to happen right now to get massive changes that literally are, federal, state, local, turn the whole thing on its head. But we don't have why is there not the funding to develop? Why is there not the inertia, the momentum to develop that kind of a movement right now? And how do we get there?
Well, if we had, 50 people in front of any major company in America, hold hand leaflets out while their employees are walking into the building in the morning and saying, did you know your third-party administrator, you're insured by United? And here's United's track record. They'd all go into that business and go, hey, what the hell is this? They're not denying here. They're denying here. What's going on? And you know what? There'll be enough, rumblings around the water cooler. Somebody be calling upstairs and they will ultimately get to the C-suite. And what's going on here? Then that CEO's going to look, I got to ask about this. And they call out to Minnesota. Hey, what's the story about you guys violating all these, these overt claims and all the rest? You get some action because you go through the employer and the employer's not going to stand for it, especially in this environment where mental health is so big. And they're going to be calling over the insurance companies and say, you got to clean up your act. So when United had this issue here, I called my friend who was head of insurance in Rhode Island, little Rhode Island. And I said, can you check to see the pattern and practice of denials that were found to be United to be violating in this court case? Can you check to see if there's any hint that the same patterns of denial that exhibited in this case are present in Rhode Island? So they, sure. And they started looking into it. Then I got a phone call from one of my good friends who clearly United didn't know that they were one of my good friends because they hired this guy to be their lobbyist. And of course, he violated every law of ethics by telling me what exactly they wanted him to do, which was to go up to the state house and cut FTEs out of the inspector's office for insurance oversight. I mean, can you imagine? Leading health insurance company in this country has the audacity to hire people to go zero out the budget that oversees their regulatory practice when they've already been caught red-handed violating federal law. Like, you just can't make this up. And by the way, nobody knows this stuff. And United hopes that you won't know about this. And of course, the press, got too many other things that are going on in the world for anyone to make a big deal about this. That's the honest truth. So you'll never read about this. But I went over to George Nee. And George Nee is the head of the AFL-CIO in Rhode Island. And he got his start as a bodyguard for Cesar Chavez out here in California, just to give you an idea about this guy, right? He's all about who's got the power and fighting for the guy that has no power. So I said to him, your state employees are covered by United. And this is what United's doing. And did you know? And this is what, and I told him all about how he had hired, that my friend was hired, who he knew, and he's like, oh my God, that's horrible. Well, you know what? United lost that contract. And I go and tell every audience I can about this story because I want United and all the other payers to know this is what awaits them. They don't care less about enforcement because the civil and monetary penalties of them violating laws are nothing, zero to them. But losing the most lucrative contracts in the state, which are being run by Taft-Hartley plans, all the big unions, who talk about their members as brothers and sisters. I mean, you could really rock the insurance industry to its core, but I need money to put that together. I need I got to have people, we got to organize this because they're going to come after me. Now, they know they're not attacking me yet because they know I got no schwack to follow any of this up. So they just let me run off at the mouth and go after them. But that's the problem. There's no backup. If I'm a candidate and I got a hot message and a great campaign, all the folks open up their checkbooks and write. It's not the case in this campaign.
So we got to go Norma Ray, right?
We got to what?
We got to go Norma Ray.
Okay.
So, right. And I know we're not supposed to be raising funds here, but we need money to do that advocacy work. Vicky, I was just going to ask if you were ready for some Q&A. Look at the timing.
Yes. Well, before we go to the Q&A, I just want to thank you, Patrick, Mark, Jonathan. This was such an informative conversation. Clearly, there's still a lot of work to be done. But we are so fortunate to have Patrick as the strongest mental health advocate in this country. You are really there sharing your voice on behalf of all of us. So thank you for all the work that you do. And we're here to help in any way we can, except writing the big check, of course, the billions. But seriously, the mental health community really applauds you, and keep on doing what you're doing. And Mark, thank you for sharing your very personal story. I apologize for misintroducing you. That was, I really am sorry, but thank you for sharing your very personal story. It was very touching, and we're very, very sorry for your loss. Jonathan, none of this
The
would
important
happen.
name is Harry, not Mark. Harry is the important one.
Of course, of course. And Jonathan, thank you. Without you, this wouldn't have happened. So thank you very much for hearing the SOS from the friends that we want this book, we want this program. So thank you. And yes, on to the Q&A. If anybody has a question, please pass your card to the aisle and we'll come around and collect it. You have one question there, John?
Yeah, it's a long question. And it really is focusing on what I think is a incredibly important phenomenon that's starting to get more and more attention, and that's moral injury. And moral injury comes in lots of different forms and is provoked by lots of different traumas. But particularly when we talk about things that create existential threat to the way life is, the way life could be, when we're asked to do things that don't feel right, when is particularly in combat settings, do things that feel completely inconsistent with our values, we suffer. And in my opinion, moral injury, and which is also suffered by people who are taken over by brain illness, I think is really the primary driver of suicide in many, many cases, particularly in non-impulsive cases that develop over a long period of time. And we have to recognize that the human condition is very sensitive, and that normal responses to situations that are really, really problematic have to also be dealt with in the overall context of the mental health systems. And there's I call it the other LOL, the lethality of loneliness, which people suffer when their understanding, their psychic structure of what is good and what is bad gets completely blown up in their face and they can't recover.
Are there any other questions? Coming.
Do you want to, I have one right here that, how strong is the disability rights group? And I would say we got a lot of questions. I'm just going to read them, and then I guess whoever wants to take them. The issue of grave disability and of involuntary treatment is an extremely important one. It's one where I was very involved at the state level and even at Fed about how to define policies to help us in the most humanitarian way give people opportunities to get off the street. And if they're unable and unwilling to accept guaranteed resources, like if you're homeless, you got to be offered housing before you get dragged somewhere else and refuse that housing. How do we help people help themselves and not die in the streets? The number of people who have died in the streets since I took over the Department of Mental Health, and now is tripled. 8 years, the numbers tripled. And a lot of it has to do with the fact that we're not taking on that humanitarian responsibility, and some of the well-intentioned advocacy against it, and I think have left us with public health and public safety challenges.
Time for one more.
I'll just say this, my brother and sister and I all got guardianship of our mother. She was going to kill herself with her, falling downstairs and over sidewalks and so forth. And she didn't like it. But now she loves playing with my kids. And she would not have been able to do that if we had not intervened. So it was impossible to get guardianship. Impossible. I was in Congress and I was like trying to exploit every advantage I had being a federal office holder to try to convince the psychiatrists at McLean Hospital that they were wrong and trying to quote unquote protect my mom's, rights, but her rights to kill herself. And that's the way it is in this country. People are going to die with their civil liberties intact. They're going to die with their civil liberties intact. Their brains are held hostage to an illness, and we just assume that they've chosen to live this way, as opposed to, like the Green Berets, kicking down the doors, dragging them out, saving them from being prisoners of their injuries, their brain injuries, their illnesses. And we just have to have a different attitude on this. Yes, we had a horrendous, history and legacy of asylums and commitments. But I will tell you, as you know, John, you say all the time, the jails and the prisons are the new asylums. The streets are the new open air asylums. Is that more dignified? So we have to be compassionate by really having assertive community treatment. And you know what? It's not, it's just going back to someone a couple of times. Give them a couple of chances. That's what we found successful here in other places, and also in California with their Orange County Care Court, is they just, instead of giving up on the person the first time, they go back 15 times. And guess what? Their rate of success in getting someone in treatment goes up immeasurably just because they went back. Now, that's like, we should exhaust that, right? But we're not even doing that.
That's right. Exhausted with guaranteed resources.